We are a group of people with learning disabilities who all use NHS services.
We would like to help you make these services more accessible for all.
This short film will help you to help us
by giving you ideas of reasonable adjustments.
These can be small changes but make a big difference.
Let us show you how.
The H.E.L.P film is to promote reasonable adjustments, to promote what doctors, nurses, hospital staff and primary care staff can do differently to make that little bit of a difference for the next time to see a patient with a learning disability. So getting it right for everyone that comes through the doors first time.
Firstly, I would like to ask them if they could talk to me first instead of my carer, or if there's something they need to know, something urgent, then talk to my carer first, as well as myself together.
Nobody was explaining what's going to happen, not understanding when they were taking blood. They just were taking blood and they're not explaining what they're taking it for. Well, I just think that they should make it a lot easier. From obviously a leaflet to say what's going to happen, an easy read leaflet so they can sit and look at it so they know, and it'll just relax them.
Health booklet is about taking the booklet to the doctor with all your information. It makes it easy for the doctor to look at, and all he has to do is just put it on his computer, on his system.
Mega madam, nobody will die me.
Annual health checks for people with learning disabilities are really important. People with a learning disability are 58 times more likely to die before the age of 50 and 4 times more likely to die of something that, if it had been identified, could have been TRET. So we can make a huge difference to the health inequalities that people with a learning disability experience by offering annual health checks. We'll be increasing the health literacy of patients with learning disabilities, so they're more aware of what health problems they should be looking out for. Also, so that health promotion can be given to them in a format that they can understand. And in addition, illnesses or conditions can be identified at an earlier stage so that patients can receive proper investigation, proper treatment in a timely manner.
GP Learning Disability QOF registers identify the needs of patients from birth onwards. It flags the patient as having a learning disability and can identify the extra support the patient needs. This is called a reasonable adjustment. It is important that GP practices identify on referrals that the patient 1. has a learning disability and 2. what reasonable adjustments must be considered to achieve equitable care and treatment. GP registers also identify who is eligible for an annual health check. This is all patients aged 14 years and older who have a moderate to severe learning disability.
My duties are to support all GP practices and the GPs, the practice staff, practice nurses, reception staff, in ensuring that people with a learning disability get their health needs met in a good, positive way. Really around the reasonable adjustments, it's around appointment times, using particular rooms in a GP practice can be more reassuring for somebody. Just giving somebody that information about a learning disability, particularly someone with specific communication needs. Having the right information, easy read information about your annual health check, a particular health condition is really helpful as well.
By raising awareness and making sure that all staff in any healthcare setting, be it hospital or primary care, is aware of what resources and support is available to help patients. Any patient with a learning disability should be able to go to any appointment, admission, GP surgery and have a good service and quality information given to them and taken from them in a format that both they understand and staff understand.
Yeah, and I think ultimately what we're hoping for is that instead of people sort of feeding back negative experiences to us, that we're getting lots of compliments and saying people did this right, we had a good experience, and that would be the ultimate, really.